discovertheforce.org.
The stigma of mental illness sometimes clouds the ability to see beyond the gray to a bright horizon, or to embrace life and truly thrive. Rosie Rinsler suffers from schizophrenia. A Forest Hills-based artist, Rosie uses her skills and a colorful palette to paint vibrant pictures of a life beyond her condition into the artistic vision of a life beautifully designed.
Art is my joy, my love, and my therapy. Artwork enhances the quality of my life 100%.
For more than 40 years, Rosie Rinsler has been taking medications to help her cope with an illness of the brain. She credits a loving family, her friends, understanding doctors, and her passion for art for her joy. But life started out a lot differently.
When I was 15, I became severely depressed. I felt that life was not worth living. I was scared. I compared myself to other kids my age and thought I wasn't as together as them.
Rosie became severely depressed. Her parents took her to see a psychiatrist who diagnosed Rosie with bipolar illness and schizoaffective disorder.
Schizophrenia is a brain disease. It tends to begin in late adolescence or early adulthood. It affects about 1% of the population, but it can be a chronic disease, so it often affects people for their entire lives.
The cardinal signs of schizophrenia are delusions, hallucinations, and difficulty communicating or constructing cohesive sentences. It also affects motivation, pleasure capacity, and cognitive functions, typically to the point that those with the illness have trouble at school or work.
So it's an illness that affects multiple domains of behavior and thought and functioning, and it is very important, we believe, to treat this illness as early as possible after it begins.
But as Rosie can attest, with the proper medical care, illnesses of the brain are highly treatable.
The medicines are miracle workers, absolute miracle workers. Right now, for the last 12 years, I've had no symptoms of mental illness, nothing. No depression, no manic, nothing. And I know that a big part of it was the medication, because as soon as they found the right meds for me, it changed my entire perspective of life.
A good deal of our research has been focusing on early phase patients. How do we help people who are experiencing the onset of this illness? How do we help them to recognize it and to get treatment in a timely fashion? There's tremendous opportunity and hope, so no one should feel that they need to live with these illnesses without help. They shouldn't be embarrassed about getting help. They shouldn't be embarrassed about, taking treatment, whatever it is, whether it's medication or talk therapy or both.
Mental illness is not a dead-end street. There is always hope. Mental illness is treatable if you go to the doctor and get the right therapy. People are ashamed, but it's a chemical brain disorder. It's something off with the chemistry in the brain, and these medicines correct it.
The message that we need to get across to people who might be hearing this and wondering about their own illness or possibility of having an illness, that the first thing is, well, let's find out. Is that the case? There's no harm in getting a consultation, finding out that, everything's okay. Or if there is an illness, then getting the right diagnosis, getting the right treatment, and then not allowing that illness to get in the way of doing the things that you want to do.
Rosie has overcome the obstacles related to her illness, and so much more.
I speak at Hillside Hospital 4 times a month on the units, the different units, as a success story and an artist. The people are inspired by me because I have a true success story to tell.
Both her artwork and advocacy are passions for Rosie, but there is something equally important to her, something precious. Rosie's life is filled with love, which she shares with her soulmate, Josh.
I have a boyfriend that I've lived with for 16 years. He also has mental health issues. Together, we work together with love and respect and gentleness, and we understand each other. We both have gone through similar stuff. And I always wanted to have a soulmate, and I was blessed with someone who really loves me, appreciates me the way I am, respects my illness.
Try to understand what they're going through, try to empathize with what they're, with the challenges that they're facing. And I think people have an easier time understanding when someone breaks a leg or when someone has cancer or heart disease than they do with understanding someone who has a psychiatric illness or a brain disease. And we need to help people understand there's really no difference.
A big part of Rosie's journey through mental illness is her message of support, love, and acceptance. Her artwork is a joyful celebration of this, a celebration of the truly important things in life.
To me, more important than holding a job, which a lot of mentally ill people cannot do, is having friendships and people in your life that care about you and love you and accept you the way you are.
Rosie's art is joyful and a true celebration of life. Like so many others, Rosie refused to be defined by her illness. Instead, she's chosen to share her triumphs with the world. In our next segment, a high school valedictorian and homecoming king enters Harvard Yard to start the next chapter